Hi, everyone. I'm Dick Deming. I'm Medical Director of Mercy One Cancer Center and founder of Above and Beyond Cancer. Welcome to our weekly cancer education series. It is funded in part by a grant from the Rosalie and Sherry Exline Ziegler Fund. Tonight, we're going to be talking about breast and cervix cancer screening, and my guest is Ashley Ezzio. Hi, Ashley. Welcome.
Thanks for having me.
Ashley is from Des Moines area and then went to Iowa State, where she majored in child, adult, and family services. And she now runs the Iowa Breast and Cervix Cancer screening program that we call Care for Yourself.
Yes.
And so that's through the Iowa Division of Public Health. So welcome.
Thank you. Thanks for having me today.
So how did you happen to go to Iowa State, number one, and to major in child, adult, and family services?
So I kind of started, I went to community college and I did early childhood education, and I really discovered I liked helping our community and our families. And so when Iowa State had this, it was wonderful. I minored in women's studies, so it feels natural to help a program that serves primarily women with breast and cervical cancer. So, yeah.
And in your training at Iowa State, what were some of the classes that you took, and what were some of the maybe the professions that this type of degree prepares one for?
It's a lot of social service work. So a lot of running programs. Prior to coming to the department, I worked at the Young Women's Resource Center, where I served young, pregnant, and parenting families. And so a lot of it was program administration with that, how to make culturally congruent, appropriate programming for folks. And so really, it's so adjacent to public health that I'm in now, serving people, meeting them where they're at, making sure they have the autonomy and education they need to make health choices. So, a lot of folks in those professions, I think, find themselves maybe in something similar to public health.
Yes, I'm sure you learn a lot about social determinants of health and the way that cancer is not just something you inherit. I mean, there is a genetic composition, but there's a lot that has to do with all sorts of aspects of our environment and our social setting that puts it at risk for cancer.
Absolutely. And, not just the health literacy and understanding what screening recommendations are, where you can get care, but also, what does your environment look like? What access do you have to healthy foods, physical activity, all of those things. And I think that's where our program really tries to focus, to make sure there's a comprehensive care team around individuals to make sure they can stay healthy.
Yes. And so this program is funded in large part by the Center for Disease Control, correct?
Correct.
And so they have a program where they grant money to the state of Iowa and to the other states.
Yep.
And you are directing that overall program. Can you help us understand how the funding works? And then second, we'll get into actually describing what the program is and what's its intent.
Absolutely. So from the Centers for Disease Control and Prevention, we are granted National Breast and Cervical Cancer Early Detection Funds, very long name. And you'll find programs like these in all 50 states, U.S. territories. Tribal organizations also have access to this funding. And so each state is able to take those funds and use them as they see fit to ensure that individuals who might have extra barriers to care, such as financial, transportation, maybe there's some fear. And so they're given this money and said, make sure that your community is healthy and screened. Here in Iowa, we do that through a program we call Care for Yourself. And so we use that funding to then give to local communities. We have 23 local programs, so that when folks are going through our program, they're able to access someone that knows their community, knows what it's like. In Polk County, that looks very different than maybe rural Iowa and Alameda or something.
Mm-hmm.
And so we give that to our local programs to really make sure folks get those wraparound services as well as screening.
Yeah. And so I think that the federal government and the CDC focused on breast and cervix cancer for a couple of reasons. I mean, one, those are two types of cancer where there is irrefutable evidence that screening is very effective in reducing the death rate due to breast cancer or cervix cancer, irrefutable. And it's also cancers that can occur at a younger age, and not everybody has had insurance, and that it works as a bit of a safety net, especially was developed before the Affordable Care Act.
Absolutely. So we've been around for 25 years, and I think you're right. The Affordable Care Act really provided folks better access to screening, but that's not for everyone.
Right.
There's still lots of folks who don't have insurance, or perhaps they have insurance, but if they need something more diagnostic, so an ultrasound or a biopsy, now they're looking at high out-of-pocket costs. And so that's exactly where this program comes into play, to make sure folks can get all of the care they need to ensure they do or don't have cancer.
And so having this program is to try to help make sure that women don't skip their screening because either they're not aware of it, or there's a financial barrier and they're just afraid to go in to get the screening. So that's part of the reason why this was set up. Let's talk a little bit about cervix cancer in particular, because it's become one of the first cancers that we know that if we enacted public health perfectly, we could probably prevent all cervix cancers. So talk to us a little bit about how one might prevent cervix cancer from happening.
So most cervical cancer, speaking to a doctor, I feel like much more, but I'll give you my my spiel on it. Is caused by HPV and the virus. And now that there is a vaccine that can prevent cancer from ever starting, that's huge. And it's super effective. I know my children have been vaccinated against HPV. And so using that as a tool to make sure that this is one less worry that our young population has to deal with. It's still very important, obviously, to get your cervical cancer screening, but done properly. You can take that kind of uncomfortable exam and space that out 3 to 5 years. As long as your tests are coming back and your doctor is recommending that. So cervical cancer screening is still very important, but it's great to have a vaccine that takes away that worry of what is causing so much of the cervical cancer.
And for those who might not know, let's talk a little bit about what the cervix is and what is the screening test for cervix cancer.
So the cervix, I wish I had my diagram to our health education, but is the opening from the uterus to the vagina. And there you would have a pap smear. And a pap test is just a simple collection of cells. And so they use a speculum that's inserted into the vagina. And then that is taken and tested. And then the HPV co-testing is kind of what it's called, happens at that same time. And so we're looking for changes on the cervix, and then we're looking for the detection of these viruses.
Right. And nowadays with just removing, just basically scraping or swabbing the cervix, some of the cells come off, and then you can actually look for the HPV virus in those cells in the laboratory. And also the inspection of the cervix and looking at the cells, you can detect cervix cancer. So it's a test that has been around for a long time, very effective screening test, and that can help detect a cervix cancer before the doctor could ever see it with the naked eye looking at the cervix. So very effective in finding cervix cancer at an early stage, where it is virtually 100% curable if you find it at a very early stage.
Absolutely. And I think our local programs are very well trained in making sure you can find a provider where that uncomfortable test, you can get that screening and it can be more comfortable. You can feel safer in those environments, and then, yes, take advantage of these early tests and preventing cancer.
And then breast cancer. So tell us about what's the screening test for breast cancer.
So for breast cancer, mammograms are the #1 gold standard. And so based on your risk factors, based on if you're having any symptoms of cancer, mammograms are recommended at age 40 and above. Obviously, if you have a family history, we need to be getting screened sooner. Our program provides mammography to make sure that your cancer can be detected at its earliest stage when it's easiest to treat.
And again, stating what we already talked about now with the Affordable Care Act, most everyone should have the ability to get health insurance, and health insurance is requires that it covers preventive and early detection screenings such as mammography and cervix cancer. But still, even though that's available to most, it's not available to everyone, and not everyone has purchased this. So we have this program to try to help catch those folks who don't get the regular screening to be able to provide it. You mentioned, so does the state of Iowa have clinics that they run to do the testing?
So we really want to make sure that folks can get care where they feel most comfortable with their doctor. So we have almost 1,200 healthcare facilities, clinics, hospitals, laboratories, radiology providers enrolled with our program.
Right. So they're not run by you.
Right.
We
are partners in making
partner.
sure people can get screening in the communities where they live.
Mm-hmm. And how does a woman access the Care for Yourself program?
So they can do it a couple different ways. Our website is, I can make sure that's available to everyone. It's long as on IDPH's website.
And we can put it into the text box.
Wonderful.
For our presentation.
So they can go there, click, and they send an email. It'll say, like, get in contact with us. You're actually talking to me directly, I promise. And I will get you in contact with your local program coordinator. So I mentioned those 23 local programs. They're all across the state. People who live in any of the 99 counties of Iowa have access to this program. We will connect them with their local coordinator. That coordinator does a simple consent form so you know what the program is, what's just what to expect. And then there's a very simple enrollment paperwork. And folks can qualify based on age and income. So folks who are 21 to 64 can enroll in the program. They do need to be at 250% of the federal poverty line or less. And I know those numbers don't mean anything, so I'm going to look at my notes. But basically, that is a monthly income of about $2,800 take home or less. And then if you add on about $983 per person in your household, that should give you a pretty good idea of qualifying income-wise. So once you qualify via age, income, and get that paperwork, then you can work that with that local program coordinator to say, I'd like to go to this doctor, or perhaps you need help finding a doctor. They can also help you do that. Should you have any transportation needs or anything else that may just be preventing you from getting screened, those local coordinators are there to help with that as well.
And those local coordinators are employees of the Iowa Division of Public Health?
They are actually housed in a lot of local public health. So here in Polk County specifically, you'd be working with Angelica, Allie, and John Viev at Polk County Health Department.
Okay.
And then as we kind of go out, there's other places. We have partners at Proteus clinics. We do have some Eastern Iowa Health Center is also a grantee. So it looks a little different, but most of them are housed in some local community spaces.
And then the funding comes from this program, and then they would get their mammogram for breast cancer or a pap smear for cervix cancer done at a health facility close to them.
Absolutely. And we can provide not only just those screening procedures. I think that's important to know. If you get to a diagnostic level, if you need an MRI or if your doctor is recommending an ultrasound, biopsy, something of that sort, the program is also available for folks in those situations.
So maybe explain to folks that, you know, the first test is the screening test. So for breast cancer, it's a mammogram. So if the mammogram's normal, then that's done. And the woman would hopefully get in the system so that she's called back for her mammograms on regular intervals. But if a mammogram is negative, and by negative we mean there's no abnormality seen, then that screening is done for the year. But if you detect an abnormality, it may not be cancer, but it's mandatory then to do further testing, either an ultrasound or perhaps an MRI or perhaps a biopsy. The screening, the mammogram, is usually covered without copay or deductible. But once you get into having more advanced diagnostic imaging to look at the abnormality, there's where the expense can really increase significantly.
Absolutely. And it gets a little overwhelming. You may be seeing someone who isn't your regular doctor. And so you're referred to a specialist. And so the patient navigators can make sure that those gaps are filled, that there's communication between the specialist and your regular doctor. Go over things and make sure you really understand what was the abnormality. Okay, what were the results? What does my follow up look like? And I think that's a really important piece because you're right. If everything is clear and good, you can high five and we'll remind you next year to go in for your regular screening. But when something's abnormal, maybe you need to follow up sooner. And so knowing that someone has your back and will remind you to get that screening.
And Ashley, you use two terms, and I just want to clarify whether they're interchangeable or they're different. You talked about a coordinator, and then you talked about a navigator. Is that one and the same person?
They are. I'm sorry. I use those interchangeably. It depends on what program you're working with, how they designate themselves, if they're a navigator or if they're a coordinator. So yes, someone who's local in your community, they may go by different roles.
So they help you get the appointment set up, and then they also help educate, interpret, follow up with what did the initial screening show, and do we need to proceed with any further testing?
Correct. Yep.
Okay. Any aspect of the screening that we haven't talked about? For example, in the state of Iowa last year, how many women got screened because or through the Care for Yourself program?
So last year, we served about 2,700 individuals between breast cancer screening and cervical cancer screening. We actually just wrapped up our last 5-year grants. They come in 5-year cycles. And I brought a few numbers just in case folks were interested in those. But overall, in 5 years, we served almost 6,800 individuals. We provided almost 10,000 mammograms, almost 4,000 pap tests, and about 3,500 HPV tests. And that detected 200 cancers. And so of those cancers detected, we were able to link folks with cancer centers so that they can get appropriate care and treatment.
Okay. Yeah, that's a significant number. And, it definitely saves lives.
Absolutely. We're pretty proud of it.
So we talked about screening, but obviously screening and finding the cancer is just kind of the first step. Right. And then there's the treatment. So if one of the individuals you serve didn't have the resources to actually get screened or have the diagnostic testing to discover cancer, they may not have the resources to actually get the treatment. So how do you help provide the actual treatment once the cancer is found?
So here in Iowa, we're really lucky to have what's called the Breast and Cervical Cancer Treatment Act. This is an option of Medicaid where we make it so that folks can earn a little bit more money and still qualify for Medicaid if they are diagnosed with breast and or cervical cancer. And I want to be, for cervical cancer, it can be pre-cancer. As you mentioned, a lot of that can be treated. And so this program or this treatment act is overseen by us here at the Department of Health and Human Services. And so we're able to enroll folks in that option of Medicaid if they have no creditable health insurance. They meet the same income guidelines as we talked about with the Care for Yourself screening program, and just make sure they can get the treatment they need.
Right. So as you said, it basically allows women with cervix or breast cancer to enroll in Medicaid with a lower income,
they can earn more.
They can earn more and still be eligible for Medicaid if they have breast and cervix cancer.
Correct.
So it allows for more people to be able to be enrolled in Medicaid if they have the breast and cervix cancer, and presumably if their income is so high that they don't qualify, that they should have income high enough to be able to afford insurance.
Yeah, I hope that is the hope, is that folks would be able to have private insurance that would step in and help them cover those expenses. But for folks who find themselves with an income that may not allow them access to that, this is a great option of Medicaid. And we have very specific coordinators throughout the state who can do this enrollment. So once again, if folks ever have questions, if you're at a health center or you yourself, if you go to our website and click that, send me an email. I would be happy to walk through that process with you and make sure you get what you need.
And you guys are great. We have helped patients get connected with you. And one of the things you do that's wonderful, if a woman's just been diagnosed with breast cancer, now they have to prove what their income is to get enrolled and able to get started with treatment. And it's like the clock is ticking. They've been diagnosed with cancer and they're waiting. So you have this wonderful ability to sort of pre-authorize the treatment and get things going quickly as you're still figuring out
Absolutely
eligibility.
And we're really grateful for partners like you, where we're able to do a presumptive eligibility application to say, let's get treatment started, let's work with your provider, and let's get things in line to kind of take some of the burden off someone who has just been diagnosed with cancer. So absolutely, that process can be very quick, where we can get a couple months of coverage while we get a full application submitted, and just make sure people are treated appropriately.
Do you have statistics on the last 5 years, the number of patients that have received treatment through the...
That's a great question, and I don't have it. I'd be happy to follow up with it. And I think,
because technically speaking, it's a separate program. So,
right.
So when you put together all your 5-year data to report back to the CDC, this comes from a slightly different program. This is from an Iowa program.
Right. So the screening program comes from the Centers for Disease Control and Prevention. And then the Treatment Act was really Iowa saying, hey, we see a need to make sure that Iowans have access to healthcare when diagnosed with cancer. And so there are separate funding streams there, but kind of falls under our purview as making sure Iowans are cared for breast and cervical.
Mm-hmm. And so the following question is probably above your pay grade, but maybe not. So we've obviously focused on breast and cervix cancer.
Mm-hmm.
They're not the only cancers for which we have screening tests, but because the CDC sort of chose those 2 cancers to roll it out to the state has embraced that. Has there ever been discussion about similar programs for other types of cancer? So the other types of cancer which there are valid screening tests for are colon cancer, prostate cancer, and lung cancer.
Yeah. So there is, I think that's a great discussion that we need to be having. Absolutely. Especially with lung cancer and all the advances we've seen recently with that. We do have a colorectal cancer program. So I have colleagues at the department who I was just with earlier today, and they are working with all of our federally qualified health centers to really make sure they kind of take a different approach. They make sure that these federally qualified health centers have the support they need to identify patients who qualify for or are needing colorectal cancer screening. And so they give support to these agencies, and those agencies in turn link folks to appropriate screening. So we do have that program.
Right. And yes, I think Gina is one of the folks that run that.
Shout out to Gina Jones.
Shout out to Gina. She does a great job. And for those who don't know this federally qualified health system, those are, again, intended or serve a safety net purposes. They are able to provide services for individuals with lower income, with less financial burden.
Mm-hmm. They might have a sliding fee scale. So if someone is completely uninsured, they're able to say, okay, let's look at how much you can afford. So yes, absolutely.
Right. Here in the Des Moines area, the federally qualified health program is the primary care, it's called.
Primary healthcare. They're great partners. Yes, absolutely.
But the lung cancer too. So the number one risk for lung cancer is cigarette smoking, and we now have a screening program. It's low dose CT scans that are done for individuals who are at high risk for developing lung cancer, and the risk is defined by how much you've smoked over your lifetime, and are you still smoking, or did you have you stopped, more than 10 years ago, and helps determine whether you're eligible for the screening.
That's and once again, like a screening that can prevent cancer, catch this early is just so key, and making sure people are talking to their providers and being honest about those things so they can get the care they need. And yeah. love to learn more about lung cancer in general.
So to summarize, we've been talking about the breast and cervix cancer screening program in the state of Iowa called Care for Yourself, and then also talking about the program in the state of Iowa where cancer treatment for breast cancer and cervix cancer can actually be paid for under certain circumstances. Again, how would an individual, can they just look up on the internet Care for Yourself?
Yes, if
Iowa?
you type in Care for Yourself, Iowa, we should pop right up. If you go to the website, there's a phone number on there. If you feel more comfortable making a phone call, they will direct you to me. So it's not some stranger, it will be me. Or you can click the link and send us an email. I'll make sure that you get connected with someone local in your area, answer any questions you may have lingering about the program and what we've talked about, and get you connected.
Do you have any personal stories where you've actually been able to, personally interact with the women that you have served?
Yeah, as we were talking about before, I have a few close folks. I have a close colleague who I think might be watching today, who works with me at the Department of Health and Human Services and is a strong survivor of breast cancer. And so she's been a wonderful advocate for programs like these, knowing how important it is to get screened. She had no symptoms, no issues, very healthy. They caught the cancer early, and we're so grateful at what she's done. I also have a really personal friend who might be watching too. Shout out to Natalie, who was just diagnosed with breast cancer and just had surgery, and just always blown away at her strength. And she was able to benefit from some of the services we provide here at the department. And just knowing that we're here to support you, your health is important to us, and we want you to have access. So yeah, it is very personal to have friends' lives saved.
Yeah, so shout out to Lindsay and to Natalie as well.
Yes,
yeah. Good. Well, let's open it up to questions. So we've got a live studio audience here. We'll get questions from the audience, and those of you that are watching us live streaming, if you could just put your questions into the chat box.
Natalie, at what age, like, do you give this information out to high school girls, like in health education?
I think that is a great point, to make sure that in high schools that it is talked about early. We have since just in the last year, we opened up our age group to 21 to 64. Previously, we were really focused on 40 to 64, but we saw a need in the younger population to address cervical cancer screenings. And so we're just embarking on making sure that this is discussed in a younger population. And I think that is a great piece I'm going to take back, because I think in health education, we do need to talk about cancer screening, cancer prevention, to prepare folks for what will come.
So Ashley, and it's a question for Poon, who's asking the question, and Ashley. So you have children that have, I don't know where they are in school. I know Poon's children are out. What's health education like in schools, in junior high and high school? Do students learn about cancer screening? Do they learn about pap smears? Do they learn about HPV?
I think it depends. Working for the Young Women's Resource Center, and my poor children, they know all about it, of course, because this is what I have done. But I think there is some conversation about pap smears, but not really from this cancer prevention stage. I think it's more of a pelvic exam conversation because we're so focused on sexual health. So I think you're bringing up a really important point. And my children are 14 and 12, and so they are getting health education through their schools, and very grateful that happens. But yeah, we probably need to expand the conversation more and talk about that.
And also college students, those are very sexual involved, and do we educate them?
Absolutely. And I think just teaching that autonomy, that this is your body, let's keep it healthy, this is how you keep it healthy, that your healthcare provider is trusted and wants what's best for you. And so we are doing more outreach to college students because they are at the age where a pap smear is now an appropriate screening tool, and working with clinics that have good rapport and relationships with our college students or folks that are that age.
Thank you.
Other questions from the audience here or online?
I got some comments online. You're right. Natalie says she loves Ashley, so that was on there. A question that I have, as far as state budgets are concerned, I mean, are you getting the resources that you need? Is it growing, contracting? Or where are you at with just resources?
Resources are tight, I'll be honest. The Centers for Disease Control and Prevention, the budget that they get was a little bit less than what they would normally give out to states. And so states are functioning with a little less money than they had before. So we are trying to get creative with just ensuring that we can still serve as many folks as we need to. And so we are partnering with other organizations that do fundraising and making sure those funds are used in an appropriate way where we can screen folks. So
Ashley, do you know, do county public health departments complement the funding through the county budgets?
Absolutely. I know here in Polk County specifically, we're very lucky to have a supportive board. And so my partners at Polk County Health Department, I believe, do have some other funding options they can use to supplement the work we're doing. And you'll see Bras for a Cause may supplement some screenings in southern Iowa. I think there's some in northern Iowa. Komen has also been a supportive partner in some of this. And so there are some other grassroots organizations throughout the state that also complement what we're accomplishing.
Okay, good. Other questions or comments, George?
So a question, someone's been diagnosed with cancer, obviously, a little semi-panic. They may not want to jump into the bureaucracy. We've had the web address up and the phone number to contact you, but it's not like they have to come down to your offices and spend a lot of time with you. You're just getting them to the people that they need to get well or to get screened, correct?
Absolutely. And actually, enrollment in our program, you may never have to walk into an office. You can do this all over the phone, consent and enrollment. And so absolutely, you don't have to make one more trip because we want you to prioritize going to your doctor. So it can be very, very simple. I promise it's not lengthy.
Do you have to make copies of your income tax returns for 5 years or try to find income statements?
So for the screening program, absolutely not. All I need to know is how much income you're bringing home and how many folks are in your family. For the Treatment Act, that is a little different because it's an option of Medicaid, but happy to walk you through that and help get through all of those documents and paperwork. So we do try for the screening and to make things as simple as possible.
And conceivably, one phone call, you could get all the information and move forward.
Absolutely. That is always my goal. When you contact me, I don't want to send you to someone else and then have someone else. If I can, I will collect all your information and make sure that you have coverage and that you feel comfortable going to your provider. And we'll make sure someone follows up, gives you a call, and reminds you to come back next year.
And I can vouch for how simple and straightforward it really is. And so, but that's a good question because you go, oh gosh, this is going to be calling the government, and I'm sure I'm going to get just voicemail, and then it's nobody's going to call me back. Yes. But your office and you personally, just I'm really pleased with the personalized service you provide.
Yes. And when you do call the state office number, my friend and coworker, Adriana, also speaks Spanish. And so I never want someone to feel like that would be a barrier. She is talented in ways I am not. And so she is also able to do the consent and enrollment and coordinate that for you as well.
Okay. We have another question over here, George.
Oh, sorry.
So I'm part of the Army of Pink, yes. And I think you guys have come to some of our events. So we usually give out information like at the state fair about screening And someone will come up and say, I have dense tissue, but I cannot get the screening I'd like. Would you guys help with that?
Absolutely. And we just had Dr. Jean Paul came and
Yes,
spoke
yeah.
to all of our Care for Yourself coordinators so that they really have that background too and can spread Iowa Army of Pink's message. So that is a great question. Absolutely. If insurance is not covering perhaps an MRI or an ultrasound that's necessary for your breast density, the program is here to help with that as well.
Adriana has been to a couple of our events.
Awesome.
Yes,
I'm glad to hear
because
that.
I didn't meet her.
Yeah, we talked about screening and diagnosis and treatment. So how about the group of people who have been deemed as in remission or cured? Do you suggest that they go through the same regimen of the screening processes after that?
I might let
Yeah.
you take that one.
So let me explain what they would need to have done. And then the question for you will be, are these services covered? So if someone has been treated and is cancer free, well, they still need to have ongoing surveillance. It gets a little bit in terms of terminology. When do you, as a doctor, order a screening mammogram as opposed to a diagnostic mammogram? So a diagnostic mammogram means that the patient either has signs or symptoms of cancer and you want to do a examination that is more thorough. We are being encouraged more and more, once a patient is cancer free, to check the box that this now is a screening mammogram. So it goes back to being screening, and then that would fall under the same rules for screening. So I would say that within a year of having completed cancer treatment and being cancer free, the mammograms can be ordered as a screening mammogram as opposed to a diagnostic mammogram.
Right. And the program would go based on provider recommendations. So folks who are in remission, we want them still enrolled in the program and we want to make sure they're getting their screenings. So absolutely, we're supportive and here for that as well.
Great question. Any other questions on the online, George?
No, I don't see any online.
Okay.
Maybe you talked about this, but I see from the brochure that people can actually get assistance with things like transportation and making appointments and that type of thing. Could you explain that?
Absolutely. So those local programs I've talked about, they house all kinds of programs to help community members. And so they are able to coordinate transportation, whether that is an Uber or if that is a taxi, or perhaps some of our local programs actually have their own transportation services. So if that is a barrier for you, maybe you need a gas card, those are available through our program as well. Same with if you're looking for an inclusive healthcare provider. Perhaps you need someone who is Safe Zone certified. They have access to make sure they can refer you to a clinic that can do that. And then once again, fear, addressing any of those fears you may have lingering that are just stopping you from not going in. So we can provide help with that as well.
I think we're seeing that more and more as we realize that effective healthcare is not just seeing a doctor and what happens in the doctor's office. That effective healthcare requires reducing the burdens. That it requires, a healthy diet, and it requires transportation, and it requires access. It requires income support, and more. There are health systems that are trying to look more globally at all of those factors and interact collaboratively with what we would generally call social service providers to have these types of wraparound services to provide, because it doesn't do any good to get a prescription written on a piece of paper and not have any ability to get it filled. So the doctor has done his job supposedly, but the patient's health doesn't improve because of other barriers. So it's good that you guys have seen that as an issue and aren't just mailing out a voucher in the mail just somebody to go get a mammogram, but are making sure that all of the needs of that individual are being met, and that the mammogram will be done, and that someone will help interpret that and get them the care they need.
Yeah. And healthcare really is, it's about well-being. It's about taking care of the whole person. And I think it's great that we're moving towards that. Really proud that programs like these can provide those services in conjunction with what healthcare providers are doing already to address some of those needs. So absolutely.
So, well, this has been great. So we've learned about breast and cervix cancer screening, and we've learned about the wonderful program that the state of Iowa runs called Care for Yourself. We've got information on how to access that. So Ashley, thanks for being with us
Thanks for
tonight.
having me.
And thanks everyone for attending. If you know someone that would benefit by getting the information that was provided in this conversation, this video podcast will be available on demand at the Above and Beyond Cancer YouTube channel or at the Mercy Cancer Center website. And you can watch it over and over again. So I hope you'll come and join us again next week for our cancer education series. This is Dick Deming. Thanks again for joining us.